Are circuit breaker lockdowns something more jurisdictions should consider instead of resorting to the long-term lockdowns like the ones we saw in the spring? Dr. Patricia Daly, Chief Medical Health Officer for Vancouver Coastal Health, and Raywat Deonandan, epidemiologist and associate professor at the University of Ottawa, join us now. Good morning to you both.
Good morning, Matt.
Raywat, let's start with you. And just in terms of what you just heard from Dr. Matani, how much would a circuit breaker lockdown help in Alberta, given what she's just described?
It would help. It would definitely help. The problem is, once you're done, you're right back where you started. And I liken this to treading water in the middle of the ocean. A circuit breaker is a helicopter that shows up and picks you up out of the water, gives you a chance to catch your breath, but then drops you back in the water again. So it's bought you some time, but hasn't solved the problem. What we want is the helicopter to drop you down with a life raft or some kind of plan to get back to shore. So it's not an ideal scenario, but it is an option, and I think they should consider it and some other options.
Can I just ask you briefly just about the language? Circuit breaker versus lockdown. I mean, circuit breaker sounds a little bit less draconian than a lockdown, but is it essentially the same thing?
It is exactly the same thing, and the terminology was invented by British advisors, I think intentionally to make it sound more palatable to the public, because it describes a process and an intent, which is great, but it is ultimately an economic restriction that is identical to an economic lockdown. It's just a shorter term one.
Little sound in the background there of another guest. Dr. Patricia Daly is listening in as well. You're right in the middle of a 2-week lockdown in BC's Lower Mainland. Tell me about the decision-making that went into bringing in those restrictions.
Well, I think we have to remember, first of all, that we've seen cases increase as other provinces have over the fall. But our goal now is not to drive those cases down to as low a level as possible, because in order to do that, the consequences of those severe lockdowns are dire. And in some cases, they're worse than the virus itself. So we've reopened our provinces quite consciously, knowing that we would get a rise in cases. Our goal now is to ensure that we don't overwhelm our healthcare system and also protect those who are most vulnerable to severe disease. So in BC, listening to Dr. Mathani, our short period, 2-week period of new restrictions, which is only in the Lower Mainland, was done before we overwhelmed our hospital system. We have a slight increase in hospitalizations, but we're not at the place where we are having to restrict healthcare services or ICUs are overwhelmed. So our lockdown is and it's also targeted to where we're seeing the highest number of cases in the Lower Mainland. And we're also focusing on the locations where we know transmission is occurring. So we've learned a lot about this virus since the spring. Those kind of broad, severe lockdowns, indiscriminate, the public would not put up with those anymore. And we need to use the information that we've gleaned. In BC, our 2-week period will restrict social gatherings in private dwellings, because that's actually where we've seen most of our transmission. And we're also pausing group fitness classes and other recreational activities. It will give us a chance to improve the safety plans in those venues. So when we do lift this lockdown, it won't be with the same guidelines as we had previously. It will be with new and improved guidelines.
And again, the question that I asked Dr. Matani is 2 weeks enough? That's only one incubation period. So is that enough, do you think, to really get transmission to a manageable level in the Lower Mainland?
Well, remember, our goal is to flatten the curve, not to reduce the number of cases to as low a level as we might have seen in the summer. Is to monitor the hospitalizations. And we will have some indicators, even in a 2-week period, of whether or not we've had a benefit. So by next week, cases may not have come down, but the new cases we're seeing, we hope will have fewer named contacts because they won't have had those social gatherings that they might have had 2 or 3 weeks ago. And in BC, we still are doing active case and contact follow-up, so we should be able to monitor that data. And if we can see that going forward there's smaller numbers of contacts, we'll know that over the coming weeks we're not likely to see as dramatic a rise in cases.
Have a listen to Dr. Mike Tildesley. He recently co-authored a circuit breaker study, and it was presented, as Raywat mentioned, to the UK government.
This is sort of the key thing with the circuit breaker, that we know that lockdowns are economically damaging. That's one of the key things, and we know that they're damaging for people's well-being. If you announce a control measure is going to happen maybe 2 or 3 weeks in advance of it happening, what you do is you can mitigate a certain amount of that. So, for instance, the hospital hospitality sector, say restaurants and pubs, can maybe not sort of buy in all the sort of food and drink that they might be using over that period, and you avoid situations like we had again in the UK in March and April, where there were pubs who were having to pour beer down the drain because they weren't able to sell it. And so there are certain kind of obvious impacts that could be minimised if it's announced enough in advance.
Raywat Deonandan, can a circuit breaker help with the economic factors that inevitably come into play if you are shuttering businesses?
Well, that is a question for an economist, but it seems so on the surface, if I would take a guess. My issue is that it probably isn't enough to solve the problem. And I told your producer, this following thing that will probably get me into trouble, get me some hate mail. I think a circuit breaker is a compromise between doing nothing and doing what you need to do, right? So what you need to do probably is a more long-term suppression strategy followed by mitigation rather than this short-term break in the system leading to, again, a rise in the cases when you lift these efforts.
So why aren't societies doing what they need to do? You'll often hear, I mean, we're seeing this across the country, public health officials who are getting advice, if I can put it that way, from epidemiologists, from frontline healthcare workers saying, this is what you need to do. And that action isn't being taken. People have said that this is a politicization of the second wave in some ways. Is that what you see, Raywat?
A little bit. There's some political fear, obviously, in not offending the business sector, and I understand that. People are going to suffer from loss of jobs. That's an important consideration. But I want the economists to step up and tell us what is less painful, a series of circuit breakers over the next few months, or one hard piece of pain right now in the form of a suppression, followed by an open economy with extreme public health assets in place. No one's done that analysis as far as I know, and it may turn out that having just a sharp, extreme lockdown now, followed by an open economy with restrictions, is actually the safer and less costly and less psychologically damaging way to go.
Dr. Daly, you and I have spoken before about the mental health impacts of lockdowns and the concerns that you have around that. Do we need to Raywat's point, take extreme measures just to ensure that this is dealt with in a way that is going to be meaningful?
Well, first of all, as a public health physician, my concern is the overall health of the population, and that's not just the number of COVID-19 cases. I am concerned about the harms that occurred with the very indiscriminate type of lockdown that was put in place in the spring, which was absolutely necessary at the time. But I think now we need to use the information that we've gleaned about this virus, how it's spread, and where it's being spread. And for some populations, the impact of the lockdown itself would be actually more harmful to their health than the virus. So that's where we need the right balance. And it's not about driving the number of cases down as low as possible. It's about flattening the curve and maintaining access to the healthcare system so we don't overwhelm our hospitals and our intensive care units. And that's the kind of data that we've used to make our decisions here in British Columbia. It's entirely driven by public health. For example, we have not shut down restaurants because our COVID safety plans are very robust in our restaurants, and we're not seeing transmission in restaurants in the recent months. Our lockdown is specifically focused on where the data is telling us that transmission is occurring. We've kept schools open, daycares open, and that's what we need to monitor. And it is a balance. This is not political. This is about public health, considering the overall health of the population.
Dr. Vera Etches in Ottawa said that we need to learn to live with COVID with care. Is that in some ways what you're hinting at, Dr. Daly? That we need to figure it, this isn't going anywhere, and we need to figure out what the best way is to manage this?
That's exactly right. I completely agree. This is an established virus in our population now. Even with the vaccine, the virus is not likely to disappear. We certainly will see levels come down, and we're all looking forward to that. But given that it is established, our goals are different. Our goals are to protect those most vulnerable to severe disease, our older population, those who live in long-term care, while also considering the overall health and well-being of the rest of the population. For young, healthy adults who are primarily and very severely impacted by the lockdown, this is a very mild disease. We knew when we reopened the economy that there would be more transmission. That's not unexpected. And so we need to have that balance of goals, understanding that it will circulate in the population. Now our goal is to protect those most vulnerable.
That sounds like harm reduction.
It is a little bit. And speaking of harm reduction, populations like those who are addicted to opioids, during the spring lockdown, we saw a dramatic rise in opioid overdose deaths. Those are the kinds of harmful things that we have to prevent, and that's why we need a more measured approach now, even as we go into these short circuit breakers. And by the way, I also think you'll get more public buy-in at this stage of the pandemic if we do this for a short period of time, monitor closely, and then reevaluate.
Raywat, if we are bobbing in the ocean and we're looking for the helicopter, do we need that public buy-in as well, just to ensure that the public is alongside whatever measures are taken?
Yes, that is the great confounder here. I'm fond of saying public health is the art of the possible, and the public determines what is possible. If the public is not on board with a suppression technique or an elimination strategy, then so be it. Then we have to find this so-called balanced approach, which involves a series probably of circuit breakers. But if the public is more amenable to an elimination strategy, as we've seen in Australia and New Zealand, possibly in Scotland, or a long-term suppression mitigation strategy that we see in East Asia, then we can pursue that goal as well. So there are several tools on the table, and my frustration is we haven't had a national or even a provincial conversation about what the long-term strategy needs to be, because this is a many months and possibly years-long ordeal we have to live with. This thinking lasting only a few weeks at a time is not going to solve the problem.
But you can understand why people are focused on the immediate, given the situation that we're in right now.
Absolutely. But my frustration is with the leadership, not with the people. I understand people. I get it. But the leaders need to have a longer-term vision.
It's great to speak with you both, as always. Thank you very much.
Thank you.
My pleasure, Matt.
Dr. Patricia Daly, the Chief Medical Health Officer for Vancouver Coastal Health. Raywat Deonandan is an epidemiologist and associate professor at the University of Ottawa, who was juggling his young son on his chest as he was talking.